Earlier this week, I saw somebody on social media, let's call him Joe, state that he was a licensed psychotherapist, and that's not a real thing. And so after seeing Joe misrepresent credentials and give some questionable therapeutic advice, I thought, hey, maybe it would be helpful for the average person to know what are the real legitimate licenses, at least here in the United States, when it comes to mental health. So first, arguably the most well-known is the licensed psychologist. This is somebody who has earned their doctorate in psychology and also done thousands of hours of supervised clinical work with real patients and taken their board exams. Psychologists have an incredibly broad, what's called scope of practice, meaning they could do a lot of different things depending on what they've specialized in their training and subsequent career. They're also one of the specialties that can do lots of psychometric testing, so to test for things like, say, ADHD for anyone, not just their own clients. Next up, we have our master's level therapists. These are individuals who have earned a master's degree in their respective field and again done their supervised hours and taken their board exams. This includes licensed clinical social workers, licensed marriage and family therapists, licensed professional counselors or professional clinical counselors, and licensed mental health counselors. Now, there's a lot of overlap between those different therapists, and they're all great. So you really want to know, what did my individual therapist or potential therapist actually study? Now, very broadly, social workers often will study social support systems, helping clients navigate them, including things like job placement, connections to healthcare, but can also do a variety of other things. Whereas marriage and family therapists are typically systems focused more generally, meaning understanding family system, parent system, couple system, social system, and helping people navigate how to make changes to those. Now, last up, and I'm being really brief here, I'm happy to talk about each in more depth in a future video, we have psychiatrists as well as psychiatric nurse practitioners. Psychiatrists are medical doctors, and I've saved them for last because often they are really focused on medication management and more of the biological pieces of mental health, at least more these days. But not necessarily. Some also study how to do face-to-face clinical work and do continue to do talk therapy as well. Now, I know I'm keeping it super brief on each one because there's a whole bunch, but I hope that's helpful. If you'd like me to talk in more detail about any of those topics, just throw it in the comments below.